Hello everyone, welcome back. Now we will continue with a very small disease which is termed as Priapism. So Priapism means unwanted erection actually, which is usually painful, which can even last more than 4 hours, which is not at all related to any of the sexual thought or arousal. And it is not even relieved by orgasm or masturbation. So that kind of an erection is priapism, and it is a very uncomfortable situation for males. So this condition develops when the blood in the penis become trapped and unable to drain. So the blood can be the venous blood or it can be the arterial blood. So commonly seen in 5 to 10 years of age and 20 to 50 years of age. If we are not able to treat it properly, it will lead to damage to the erectile function of the penis. So that is priapism, an unwanted erection. So now we can see different types of priapism, which is divided as ischemic priapism and non-ischemic priapism. So first one is ischemic priapism, in which also termed as no flow priapism, and it is the common form of priapism, which is itself considered as a medical emergency, which will have an erection more than painful erection more than 4 hours or days, even days. So it is caused by, what is the main cause? It is caused by obstruction in the penis venous drainage. So when there is any blockage in the venous drainage, there will be buildup of poorly oxygenated blood, commonly in the corpora cavernosa. Corpora cavernosa is the spongy tissue in the penis which will help in the erection. So due to this accumulation or buildup of this poorly oxygenated blood, there will be unwanted erection. Sometimes it will come as on and off erection. So that kind of erections is termed as stuttering priapism. So that is about ischemic priapism. Second one is non-ischemic priapism, which is not as common as ischemic priapism and not as painful. What is the cause of non-ischemic priapism? It is commonly caused by any of the injury to the penis or perineum which will rupture any artery. When in ischemic priapism, it is due to the venous drainage, but in non-ischemic priapism, it is mainly due to the injury to the or rupture of the arteries. So when the artery has been ruptured, a gush of blood will be reaching towards the penis continuously, which will lead to erection. Hence, it is also termed as high flow priapism. Okay, so these are the types. So next is the causes. What are the causes? Maybe we already studied that due to the rupture, what happens? Gush of blood is occurring. So rupture can occur due to any trauma or injury. In the other side, there may be obstruction of the venous blood flow. Obstruction of venous blood flow will be commonly seen in blood disorders like sickle cell anemia, leukemia, thalassemia, etc. Besides that, there will be other causes. Usage of antidepressants as well as blood pressure medication. Unwanted dilation of the blood vessels will lead to over blood flow to the penis. It will lead to priapism. Some case spinal cord injury or trauma to the genital area, or we have seen black widow spider bites as well as carbon monoxide poisoning. Both of this black widow spider bites the poison in the spider will lead to unwanted dilatation of the smooth muscles as well as blood vessels. Similarly, the carbon monoxide poisoning, and also the marijuana and cocaine, and also this unwanted erection is seen in anesthesia. So next is the clinical features. So in ischemic priapism, we can see the erection which is last more than 4 hours. Comparatively to the non-ischemic priapism, the erection will be up to 4 hours. So in ischemic priapism, we can see a rigid penile shaft. Meanwhile, in non-ischemic priapism, we can see a not rigid penile shaft. In ischemic priapism, it is usually painful, as well as we can see a tender penis. But in non-ischemic priapism, it is usually painless. But both cases is not at all associated with sexual stimulation. Without any sexual stimulation, erection can occur. Next is diagnostic evaluation. We can diagnose. We have to diagnose with the help of proper medical history, because underlying medical disorders like thalassemia, blood-borne disorders, or spinal cord diseases, injury, trauma, all these can lead to priapism. So medical history collection is very important, as well as examination. Blood test, we can find out the sickle cell disease or any blood-borne disorders. Doppler examination, we can classify into ischemic or non-ischemic priapism by with the help of colored Doppler. How can we manage? We can manage the case with the help of treating the underlying causes. But our aim should be reducing the erection as well as reducing the pain, and hence to preserve the normal erectile function. So in early stages, we can start with home remedies like cold shower or ice pack, which can be used. Sometimes we will start with climbing stairs to improve to re-establish the blood flow. So that kind of exercises. Medications like analgesics or opioids can be used in order to control the pain. Other treatments like aspiration. Aspiration is nothing but we have to use a small needle to aspirate a large amount of blood from the vein, and we can before the procedure we have to anesthetize the area. Okay, so sometimes aspiration follows a flushing of normal saline into the venous circulation. So that is aspiration. That is rarely done. Next is intracavernous drug therapy. So this is nothing but neosporin or phenylephrine, which is an alpha agonist, which will be injected to the spongy tissues of the penis, which will help the veins to open, hence to resolve or relieve the obstruction. So the blood circulation will be re-established. So that is intracavernous drug therapy. Next is shunt therapy, rarely done. So this during the procedure, a surgical shunt is being created in order to restore the normal blood circulation. So the treatment for non-ischemic priapism, we will be using embolization or surgical ligation. So what is non-ischemic priapism? In which the artery is being injured. So injured artery will be repaired here. So embolization means obstructing the ruptured artery with the help of coils or glues. We will be obstructing or closing or embolizing the ruptured artery. Surgical ligation, ligating the ruptured artery. So these are the other treatment. So next is the prevention. Prevention is nothing but we have to identify the underlying disease and we have to treat accordingly. Changing medication if prescribed medication was a probable cause. For example, antihypertensives. We have to avoid antidepressants. So we have to avoid triggers like we have to avoid the bite from the spiders. We have to avoid anesthesia in some cases, alcohol or illegal drugs. So that is about priapism. Hope you understand. If any doubts, kindly ask. Thank you.